Hello and welcome once again to Info Corona, the show that separates the news from the noise. It's been a little over 2 months since the country announced a lockdown to control the spread of the viral Covid-19. Infection cases still continue to pile up. The economy continues to spiral down. But there is another health crisis that has often been ignored that may be now rearing its ugly head. Experts are warning that an unprecedented wave of mental health problems is fast approaching India and the world. That's our focus on Info Corona, looking at the mental health challenges that COVID-19 are throwing up in an age of extended lockdowns. Take a look.
First, the fear of getting infected by the virus. Then, the loneliness of waiting out a lockdown, away from loved ones. Add to that months of anxiety and grief over those who did not make it. Topped up with economic uncertainty and job losses, creating a storm of mental health illnesses. Experts across the globe have warned of an upcoming surge in the number of people showing signs of clinical anxiety, depression, and other mental health issues.
There has been an enormous burden on mental health with this virus because you have people who are dying alone, you have people who are becoming depressed. So let us please substitute physical distancing for social distancing. We still need to interact. This is what makes us human.
The World Health Organization pegged India's suicide rate higher than the global average. In 2018, India reported 134,516 suicides. But most independent estimates show that the numbers are possibly underreported. And adults aren't the only ones. The parameters for children and young people isolated from friends and school at this time are equally grim.
करीब 5 करोड़ लोगों तक मैं पहुंचा और मेरे ध्यान में आया कि निगेटिविटी है, नर्वसनेस है, फ्रस्ट्रेशन है. कुछ लोग तो बोल रहे हैं हम सुसाइड करें, यहाँ ऐसी बातें करने लगे थे. तो पॉजिटिविटी एंड सेल्फ कॉन्फिडेंस और हम जीतेंगे इस प्रकार का आत्मविश्वास जगाना ये सबसे आवश्यक था.
Many believe mass unemployment, depleted social safety nets, starvation, increase in gender-based violence, homelessness, alcoholism, loan defaults, and millions slipping into poverty due to the pandemic will all add up.
We have seen in the past that similar cases of economic crisis have increased the number of people with mental health issues, leading to high rates of suicide, for example, due to the mental health.
According to new Census Bureau data, a third of the population is showing signs of clinical anxiety or depression in the US. Globally, healthcare workers who are seeing thousands of patients infected with and dying from the coronavirus are also deemed as high risk of facing mental health trauma. Recently, the United Nations has urged countries to invest in mental health services and to work proactively with anxiety-afflicted populations in the days to come.
And perhaps one of the groups that, in a sense, is the worst affected are senior citizens. Remember, many of them have been locked down at homes now for more than 3 months, are not allowed to travel out because they are seen to be the most risk-prone. They're living, in a sense, with an impaired immune system. Let's focus on how the pandemic and lockdowns have affected the elderly and those with comorbidities in particular.
When the COVID-19 pandemic took hold of the world, everyone was shunted in. But now as the world eases its lockdown measures, two demographics have no choice but to continue to stay in. Because without a vaccine or a cure in sight, the elderly and those who are not so old but immunocompromised remain in peril.
They are definitely at a much higher risk of acquiring COVID-19 as well as at a higher risk of dying from it. So they have to take special precautions. It is advisable that they should stay indoors as much as possible.
In these times, the vulnerable elderly are grappling to balance their health and household chores because many are having to spend the lockdown alone or with little help. With their social lives forced shut, many senior citizens are facing high levels of anxiety along with the fear of getting infected by the virus. An anxiety and fear echoed by others who live with a weakened immune system or those with health conditions like diabetes and hypertension, medically deemed as people with comorbidities. So we asked medical professionals, how can those with a compromised immune system navigate a future where the virus still exists?
You can meet your children, your grandchildren, but as far as possible, wear masks before you meet them and maintain a 3 to 6 feet distance wherever possible.
The time spent within the hospital also should be minimum. They must request for an appointment at a time when the crowd is less and the waiting time is also less. The number of hospital visits should be minimized.
Meeting people, having gatherings, going into the crowd, starting your weekly meetings where you are playing cards or attending even shorter group of meetings. Avoid them for some time, even if you are wearing a mask.
To boost immunity, they must maintain their healthy lifestyle, continue to do exercises as much as possible, and maintain a healthy diet. They must include some vitamin supplements, also include ginger, lemon, honey, all these things in their diet. These are substances known to boost the immunity.
The aged are at greater risk and they need to take more precautions than those with higher levels of immunity. But medical professionals feel that it is equally, if not more important, to maintain the emotional and psychological balance of the aged and the infirm, because better mental health leads to being able to better adjust to these trying times.
So how does one cope with the mental health challenge that that the coronavirus has thrown up? I'm joined by Dr. Vikram Patel, one of the country's leading clinical psychiatrists, Professor Global Health at the Harvard Medical School. He also runs several NGOs working in this country in the field of mental health. The entire area, Dr. Patel, of depression and anxiety that people are facing at the moment seems to have got less attention during the course of this pandemic. How serious do you see this mental health crisis at the moment because of an extended lockdown?
Well, I think there are two different phases of the mental health crisis that we're going to see, Rajdeep. The first is the phase that we're seeing right now that is really linked to the fear about contracting the infection. And let me be quite honest with you, I think what's even more lethal than the infection right now is the epidemic of fear. And a lot of that has to do with very poorly crafted communication and information about the dangers that the virus poses. And you can see some of the tragic consequences of that, for example, in the way doctors, health workers, and people returning back to their villages are being stigmatized and discriminated against. But the second mental health crisis that is going to emerge in the coming months is the crisis to do with the economic recession and the fact that such a large proportion of our population has either lost income or will suffer enormous amounts of economic deprivations in the coming months. And we know there's a very strong association between acute poverty and poor mental health in the form of depression and suicide. And I really fear that unless our healthcare system begins to assemble the resources to address that tide of mental health problems, that we're going to see a surge in a range of different mental health outcomes, including suicide, in the coming year.
You mentioned the suicidal tendencies that can grow. You spoke about a climate of fear. Do you believe, therefore, that people need to be told very, very clearly, getting Corona A doesn't stigmatize you, and please don't be fearful of it?
Absolutely, Rajdeep. This should have been the advice right from the start. Imagine we live in a country. Let me give you some, a very simple comparator. About 4,500 people have died of corona since the beginning of this epidemic. This is a very significant number, but just out of context, about 500,000 people die each year of TB in India. Now, you see, for a population that is accustomed to people dying of a whole range of different infectious diseases, you can well imagine that the very act of locking down the whole nation in 4 hours must have instilled, even without saying anything, instilled an enormous sense of anxiety that what we are facing now is far more lethal than any other bug or disease that we've encountered before. And it's therefore quite natural for people to react with enormous fear. So yes, I think we still can, and we must modulate the information that we are communicating. And it's interesting that the government now, the Ministry of Health, has actually started moderating the information, making it clear that there are certain groups in our community, particularly the elderly and those with chronic diseases, who are particularly vulnerable. And it is our responsibility as citizens to protect ourselves, primarily to also protect the people who we are close to, who fall in those vulnerable groups.
One of those challenges, as I said, Dr. Patel, seems to be stigmatization. We've heard of RWAs, resident welfare associations, ostracizing people who get corona. We've heard of layoffs of people working on the margins in society. Does that worry you, that the stigmatization that is associated with corona is something that will live with us for a long time?
Well, in part it is. We are human beings, Rajdeep. Now, let's be quite honest. I'm an epidemiologist. That is to say, I have learned how to read the statistics and numbers that are presented to me in scientific reports. But, most of my fellow Indian citizens are not. They will have to trust the information that's being provided to them by the government, which is the most trusted source. And let's be honest, Rajdeep, also members of your community, the media. And I think it has to be looked back in time. Really, when the dust settles, I believe that there will need to be a proper accountability here to look back and understand what we could have done differently. Because let's be honest, there could be a second wave, and we should be far better prepared for when that happens. And there will be more pandemics in the future as well. And one very important focus is going to be, how does the government and the media actually convey the notion of risk in a way that is both accurate and does not actually instill enormous amounts of fear and panic. We're all human beings. I don't blame the RWAs, really. I think they're doing what any average group of human beings would do when they're really fearing a very dreaded infection affecting all their community members.
But how do you deal, Dr. Patel, with the depression, the idea of being mentally depressed, locked inside a house for months? Is there a recipe to tell people in particular who face an uncertain future, whether it's the elderly, whether it's people who fear losing their jobs, are gripped with anxiety? Is there a solution? How do you address the issue of depression and suicidal tendencies?
Yeah, it's a great question. I get asked this a lot, because of course, the question you're asking is, how do you distinguish depression as a medical condition from the social suffering that accompanies it in so many instances? And of course, it isn't a very specific hard line between this is the misery of my everyday life because I've lost my job or somebody in my family has died, and this is a clinical condition. In fact, these are completely embedded in one another. And therefore, the solution to depression lies in simultaneously taking care of the mental health symptoms. And for that, there are very effective interventions, particularly in the form of brief psychological treatments. The organization that I've been associated with, Sangat, which is headquartered in Goa, but works across many states, has actually developed an incredibly effective brief psychological treatment called the Healthy Activity Program, which we're now testing for delivery with ASHA workers in Madhya Pradesh. But there's also, of course, antidepressant medication that a primary care physician can also prescribe. But simultaneously with that, and it's really important for me to say this, one cannot ignore the social factors. And the ideal way for depression to be handled is by simultaneously addressing real issues like hunger and debt alongside the mental health consequences of those issues.
Dr. Patel, the group which seems to be, in a sense, most affected by mental health issues are senior citizens. One would have thought the Indian family structures would insulate the elderly, protect them, ensure greater care. That's not always the case in New India, in an increasingly urbanized India. Do you believe that senior citizens need their concerns specifically addressed?
Yeah, they do, definitely, because let's be honest, I think if there is one high-risk group in the population, it is senior citizens. And they're vulnerable not only because the infection tends to be most severe in senior citizens, but also because this is the group that is also most vulnerable to being isolated and loneliness. Loneliness is a big killer, Rajdeep. We now know this, it's a fact. And so I think we have to try and find the right balance. And I would tell people who live with older relatives in an extended or joint family, for example, that you can remain in contact with them without putting them at risk. And there are many different ways, I think, that everybody by now knows by heart, wearing a mask, spending some time, keeping some distance from people and so on and so forth. But I wanted to say something else about another group that I think we don't talk about, and that's young people. Rajdeep, if there is one massive cohort that this country has, which is its greatest strength, both in terms of its economics, but also in terms of protecting itself from the virus, is the fact that we're a young nation. But young people today, their entire lives have been thrown under the bus. Their education has come to an end. Their job market has evaporated. And this is the age group which has the highest suicide rates in India. Suicide is the #1 killer in Indians aged between the ages of 18 and 35. Now, think about that. This is the age group that we should be really paying a lot of attention to. We don't hear anyone talking about young people's well-being, and I am really concerned about it more than probably any other in our country.
You're making an important point which we should highlight, that the young are particularly prone, you're saying, to suicide in this country. How do you then address this issue of the young who feel very uncertain about the future in Corona times?
Well, for starters, I think you need to actually get their voices onto television, into the media. How often have you seen young people on television, in the media, talking about what this pandemic means to them? How has it affected their everyday lives? What does it mean not to be going to school? What does it mean to have their examinations postponed? Do we even hear their voices? They are actually almost entirely absent from the landscape of all the different conversations that are happening. Let us actually bring young people into the debate, ask them what is the kind of organization of society that they would like to see, which protects the elders from COVID-19. Remember, the irony, of course, here for a young person is they're being told this infection has no risk to you. But in fact, your entire life has been thrown upside down because of the infection. We need to engage this community. We need to make them understand why we're doing this, and we need to actually hear what they feel should be the public policy response so that their needs can also be addressed.
But who starts this conversation with the young? You mentioned the media. Should it be started also by government? Should the government be talking to the young? Should civil society groups, possibly using digital technology, be talking online to students? Do you believe this is a partnership now that needs to be focused upon?
Well, certainly I think it's the latter, I think both have to be working together. The government, especially because the government has the responsibility for containing the epidemic, and civil society, because civil society has much better mechanisms and agencies to actually reach to a much larger group of young people. So I think it needs to be a partnership of some sort. You asked me another question about mental health. I think certainly, one advantage of being young today is that we are much more likely to be embracing digital technologies than older people. And of course, a lot of mental health support can be moved onto the digital platforms. And so actually, that's another way of reaching out to those young people who are in acute crises or need specific individual mental health support. But I don't think we should really just purely medicalize this whole issue, Rajdeep. This is a larger societal issue, and that requires acting both for individuals who are vulnerable and unwell, but also addressing the larger determinants at a societal level, which involves, of course, group level engagement rather than, in the kind of way that you described.
I had Dr. Patel, Dr. Atul Gawande, the world-recognized author-surgeon, earlier in the month on the show. He spoke about the need to change cultures. One of the challenges that people need who are, need to be much more socially aware, the risks of large community gatherings, wearing masks, practicing social distancing norms. Do you think that's going to be a challenge in a country like India, where we are traditionally involved in community lives? How do you change people's attitudes towards protecting not just themselves, but also people in their neighborhood?
Well, I'd like to think that if you properly engage communities with trust, you treat them as trustworthy citizens who can work in solidarity with the state to produce social change, I don't think Indians are any different from anyone else. Let's take one very good example of how Indians have actually modified their behavior. You and I can remember when smoking inside trains or in airports was a very, very common behavior. Today, it's very hard to see that anymore. And I think it's because people have been brought on board to understand why smoking isn't only a bad behavior for your own health, but actually because it also affects people around you in an adverse way. So I do think by not making this a law and order problem, which I unfortunately think it became in the initial days of the lockdown, it became a policing and law order problem rather than a problem of public health in which the citizenry were called on to work in solidarity with the state. And I think that is still something that we will need to do going forward. Rajdeep, there are multitudes of epidemics in India right now, and this is something else that I think we should remember. There isn't one epidemic in India. There are different epidemics in different parts of the country that are following very different trajectories. And it's very important for us to become hyper-local now, that is to say down to very small geographic units, so that we can engage people in those particular communities to act in a response to the situation in those communities. There can't be one national response for the whole country. There has to be a much more decentralized response. And in that respect, I have to say what's happening now is the right policy. But if I also want to say this, frankly, I wish this had been the policy on March the 25th. That is to say a decentralized plan on how to contain the epidemic, to communicate risk, and to engage the citizenry on collective action.
I want to come once again to the young, which you mentioned as a vulnerable group. Do you believe that parenting, when it comes to mental health, becomes critical at this time? The young who are struggling with possible anxiety over their education, over jobs, do the parents need to spend much more time with the children? Does that become even more important now?
Yeah, for sure. Particularly for younger children, parents also need a lot of support. And again, there's a lot of resources out there, but let's be honest, Rajdeep, most of these resources are digital. They really cater to a very small segment of India's people. And I really worry about what is the circumstances for children who are locked into their homes, their schools are shut down, their parents are without work, and they live in rural settings in which none of these resources that you and I can so comfortably access are available to them. I dread to imagine what is happening to their lives. And I do think that the return to school, I want to stress this, is something that we should really be looking at as an urgent and immediate priority, because schools offer children a return to normality. And it's really important to say that schools are not only places you learn geography and history, but they are places where you learn to socialize with other children and with adults. And to reduce the burden on parents as well, it's really important for schools to reopen as soon as is very possible. And let's be honest, children themselves are not likely to have any significant infection. We can teach children on how to actually protect the elders in their house through return to schooling.
You make an important point that maybe urban middle-class homes are at least protected, have resources to handle the mental health challenge. What about the migrant labor, the thousands and thousands of them who are totally dislocated economically, geographically? They perhaps, in a sense, the mental trauma that they've gone into walking thousands of kilometers to reach their homes. How does one deal with their mental condition in COVID times?
Yeah, well, I'll be honest, those are the most harrowing stories of all. They really go to the heart of the moral crisis in this country. This is obviously not something that has happened 8 weeks ago. This is a crisis that has been going on for decades. But what has happened 8 weeks ago is simply blown that crisis out into our faces so that we can all see the cruel inequality that actually runs in our cities more than anything else. So I do agree with you. It's also important to remember that most of these migrants are young people. And so you have, again, that perfect storm of young people at the highest risk age group for mental health problems, who are also being dispossessed and are being forced to return to their villages. And often when they return to their villages, they're not getting a very warm welcome. And I think this is a group for which I hope that every state in which, there are only a few states which are home to most of our workers who are returning home. I think every state needs to prepare for a reception for these people to help them readjust to the realities of their lives back in their villages and to counter the stigma and discrimination that is prevailing in many of these communities. You know, I'll be honest with you, Rajdeep, the return of the migrants is not just a question of these workers returning to their homes, but also the health and well-being of the communities they return to, because where they're returning to are places where the health system is even a lot weaker than it is in other parts of India like Delhi and Bombay. And if the epidemic should spread in the way that it has in Delhi and Bombay, in places like rural Bihar and UP, I dread to imagine what the impact is going to be on mortality.
Let me leave you with one last question. We've called this program Living with the Virus. What does this really mean, living with the virus? Leaders keep saying it. What should it really mean for an average Indian who's combating this extended lockdown at home as well as the public health crisis?
Well, I think the first thing to do, as I said earlier, is to be hyper-local. Look at the trajectory of the pandemic in your own area. And it's so important for every district to actually report not the state-level data, but actually what's happening in your district. You know, Maharashtra is a huge state. There's huge variation in Maharashtra, and we can already see that. So follow the information on what is happening in your state. You know, one of the curious things, Rajdeep, is no matter where you go in the world, the actual trajectory of the epidemic looks extremely similar. Between 6 to 12 weeks, the epidemic gradually wanes out and completely disappears. There might be a second wave, but we haven't seen one yet so far. And so what we really need to do is to see where we are on that curve. And during this period, until cases diminish to the point where there are very few new cases each day, we need to do what actually my good friend Ambrish Satwik wrote very beautifully in an article today. We should make sure we are not complacent. We should do all the necessary things that are well described. Your listeners will be sick of all the things that they're told to do, and I'm not going to repeat that because they know what it is. But I think especially during this period, while the new cases are continuing to be seen, please take precautions to protect yourself and therefore protect others. But I want to say one more thing of hope here. Remember that in every country, no matter what policies we use, the epidemic does wane. It takes about 8 to 12 weeks for it to completely reach a baseline again. And therefore, the end is in sight. No matter where you are in the country, the end is in sight. And that is something to look forward to. And during this period, just take precautions to protect yourself and others around you.
Dr. Vikram Patel, for giving us a sense of what it means to live with the virus and the mental challenges in particular that are associated with it. Thank you very much for joining me here on Info Corona. That's it on this special. Thanks for watching. Bye for now.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.